Anesthesia. Anesthesia is important in the surgery. Nowadays, without anesthesia, surgery is impossible. A good understanding of physiology and pharmacology has made practice of anesthesia much safer. That is a good approach to patient, good pre-operative procedures, good pre-medications, continuous monitoring, post-operative care. Equipments for anesthesia: laryngeal scope, endotracheal tube, oropharyngeal airway, nasopharyngeal airway, ambu bag, Boyle's apparatus, pulse oximeter, cardiac monitor, BP instrument, stethoscope, spinal needle, emergency drug tray, suction catheter, source of O2. Pre-operative assessments: a patient posted for surgery is examined at least 1 day before surgery. If patient has any associated disease which need to be controlled first, as diabetes mellitus and hypertension. History of patient from various systems are cardiovascular system, drug allergy, central nervous system, pregnancy, gastrointestinal tract, smoke and alcohol, respiratory system. Physical examinations in anesthesia: oral hygiene, examination of loose and artificial teeth, nutritional status, hydration status, build, pallor, cyanosis, clubbing, CVS, CNS, RS, blood pressure, heart sounds, examination of spine, peripheral pulsation, investigations, HB, routine urine test, blood sugar level, serum creatinine, liver function test, chest X-ray, electrocardiogram. American Society of Anesthesiologists. After detailed preoperative physical examination, anesthesiologist gives the category number to the patient according to following scale, which is given by American Society of Anesthesiologists ASA. Preoperative preparation: establish a good conversation with patient, collect history of patient with examination, inform written consent. If significant disease is present, then first it is brought under control, strictly NBM before 4 hours of surgery. Premedication of anesthesia: to allow the anxiety of patient, give tab diazepam at previous night of anesthesia. Injection diazepam given at the time of anesthesia. To reduce secretion, injection atropine 0.6 mg should be given. When narcotic analgesics used in preoperative, then give antiemetic drugs. Local anesthesia. Definition: it is defined as reversible depression of nerve impulse conduction leading to temporary loss of sensation and relief of pain because of disturbed nerve conductivity. Types of local anesthesia: infiltration anesthesia. Indications: excision of lipoma, polyp, dermal cyst, etc. Second type of local anesthesia is field block. Injection of local anesthesia so as to create a zone of analgesia around the operative field. Indications: minor surgery where the life of the patient becomes fatal due to unconsciousness. Number 3 type of local anesthesia is nerve block. Injection of local anesthetic drugs near the nerve supplying area which will be operated, that is brachial block, finger block, intercostal nerve block. Fourth type of local anesthesia is surface anesthesia. Surface skin is anesthetized by local anesthetic agents used as spray, ointment, cream, and jelly, that is catheterization, cystoscope, Riles tube, etc. Fifth type of local anesthesia is spinal anesthesia. Spinal anesthesia is a type of local anesthesia. Sixth type is epidural anesthesia. It is the local anesthesia. Principles of local anesthesia: anatomy must be known, duration of surgery, remember of drug contraindication, selection of patient, selection of proper local anesthetic drug, emergency medicinal parameters must be ready. Advantages of local anesthesia: simple administration, easily available, undisturbed body metabolism, less expensive, less hemorrhage, patient's cooperation, no explosive, easily sterilized, quick onset, safe, cheap, no special attention required, low potency with short acting, that is procaine, intermittent potency with duration, that is lignocaine, high potency and long duration, that is bupivacaine. Disadvantages of local anesthesia: palpitation, tremors, pallor, headache, allergic reactions, vasovagal shock because of partial block, nerve injury, vessel injury, not good for uncooperative patient. Complications of local anesthesia: restlessness, vertigo, tremors, convulsions, respiratory muscle paralysis. General anesthesia. Definition: the reversible loss of sensations and consciousness is known as general anesthesia. Cardinal features of general anesthesia: loss of all sensation, sleep, muscle relaxation, abolition of reflexes. Types of general anesthesia: inhalation, intravenous. Inhalation has two subpoints: gas, that is nitrous oxide, and liquid, that is ether. Intravenous general anesthesia has also two subtypes: inducing agent, that is thiopentone sodium, and slow acting anesthesia, that is ketamine, cocktail anesthesia. Techniques of inhalation of general anesthesia. Number 1, open drop method. Liquid anesthetic is poured over a mask with gauze and its vapor is inhaled with air, that is ether. Number 2, through anesthetic machine. The gaseous general anesthetics are delivered to the patient through the Boyle's apparatus, that is nitrous oxide. Complications of inhalation anesthesia: fire and explosion, hypotension, excessive secretion of salivation, respiratory depressions, laryngeal spasm, delirium, nausea, vomiting, persistent sedation. Drugs for general anesthesia: N2O, that is nitrous oxide. Advantages: this is safest anesthetic drug. It is administered with supply of O2. It is non-inflammable, non-irritant to patient, pleasant to inhale, and post-operative complication is less. Disadvantages of general anesthesia: muscle relaxation in unsatisfactory, teratogenic effect, blood pressure is increased, diffusion hypoxia, cerebral anoxia, post-operative loss of hearing. Advantages of general anesthesia: it may be used for all types of surgery. It is safe, simple to administrate. It has little toxic action on heart. Muscle relaxation is satisfactory and can be used for all abdominal operatives. Disadvantages: vapors are highly irritative. Vapor inhalation is unpleasant for patient. If an overdose is accidentally given to patient, then immediately artificial respiration is required. It increases secretions of all the glands. It causes albuminuria. Drugs for general anesthesia. Number 1, nitrous oxide. Number 2, ether. Number 3, halothane. Intravenous general anesthetic drugs. Number 1, thiopentone sodium. Number 2, ketamine. And number 3, propofol.